My name is Derek Weiss, Deputy CIO and Vice President of Strategy and Partnerships for Cambia.
Aneesh Chopra, President of Journey.
Ryan Howells, Principal at Leavitt Partners and part of the Caring Alliance.
This afternoon we participated in the AHIP Consumer Engagement and Digital Health Summit, and we had an opportunity to talk about consumer-directed exchange, a very pragmatic approach to ensuring consumers have access to the information they need and they can connect it to the applications they trust to better navigate the healthcare delivery system.
And we have just finished our session on data and consumer-driven data and connectivity across the enterprise and how it's going to change how consumers use their information going forward. I want to give it to Ryan and talk a little bit about what the Caring Alliance is doing and some of the trends that we'll be looking at as it relates to data and connectivity.
Yeah, so the Caring Alliance was formed a couple of years ago with Aneesh and David Blumenthal, and Governor Leavitt to try to advance the ability for consumers to get access to their electronic health information. And we've found a way to be able to get the industry and others that are participating in this effort to agree on kind of a central code of conduct for how to handle data for non-covered HIPAA entities, non-HIPAA covered entities, I should say. And we're also looking for ways to release more data with less friction for consumers via these APIs that are really transforming the industry, which this guy helped to be able to infuse into the marketplace.
Yeah, Aneesh has been at the forefront of this for several years. And so what are your thoughts about where we are and where we're going at this point in time?
Well, I think what we saw today is really a mind share shift that all the battles we've had over the years to try to get interoperability right by connecting doctors and hospitals on the back end to systems that in theory would allow us to talk together, take a different mind share to say, why can't we just point this information to the consumer and then they can choose the apps they trust to help them make the most sense of it? And that felt like an obvious point when we said it in the panel, but you could sense in the room this is a concept that really hadn't been part of the conversation. And given the group that we've assembled here, that we've participated in here, folks that are on the front lines of listening to consumers' needs and finding ways to help arm them with the information they need to be more successful in navigating the delivery system, this is the audience that heard and really got a bit of a challenge. Can we make a difference here? And I'm pretty excited about the attitudes that are coming into this, that we should get more and more people plugged into this opportunity.
Yeah. And that's what Caring's really working on, right? The Alliance really is bringing those people together.
Yeah, it is. And I think that from a payer perspective, we announced today this concept that we now have a common payer data set for consumers to be able to access their health plan claim information via an API outside of the traditional portal process that we've had previously. So I think that's a real breakthrough. Now we can have clinical data, we can have payer claims data, aggregate that together, provide real meaningful, actionable insights for consumers to make better decisions.
The key part of that is making sure that this is consumer driven, it works for the consumer, helps them make better decisions for their healthcare, and really allows for that interoperability, that communication across a variety of entities so that information flows really seamlessly.
That's right.
Yeah. And we joke, but actually, in all seriousness, this is about multi-stakeholder collaboration, and that means people putting in sweat equity to put time and energy in figuring out how do we get some consensus across the payer community. What should the file formats be that have been made available to these apps? And Cambia has been very gracious, really since the get-go, in putting the enterprise architects at the table so that there isn't a Cambia approach versus a United approach versus a Blue Cross North Carolina approach, but rather a kind of a let's work together as an industry. And that's the spirit, I think, by which this conversation took place today, and I think the feedback we're hearing from the audience.
Yeah. Agreed?
We could not have done it without Cambia, for sure. Absolutely.
Well, thank you both, gentlemen, and obviously leadership of the Alliance, Leavitt Partners, and obviously Aneesh, your experience and leadership of your organization, Journey, has brought this all together.
Very kind.
So,
let's get to work.